Roche is a 100 years company. And so if it's a 100 years company in the past, it's also a 100 years company in the future.
If you want to continue to exist in the future, you need to make sure that you're continuously innovating and changing and shifting.
If we really want people to recover faster, to cure certain diseases, what they really need is for us to see them as human beings, see them as people, and treat people first before they become patients.
You know, many affiliates have ideas for ecosystem shaping projects, and you know, a lot of ideas of partnering with other people to deliver better outcomes.
This is great, right? Here you see like real projects coming to life and really addressing our 10-year ambition.
Many people across the ecosystem are still focusing on the challenge of today, rather than thinking about the future challenge that will happen in 2030.
Roche is adapting to different geographies and generating co-creation solutions that can be scaled for an impactful transformation of how we serve patients with the whole ecosystem of healthcare life sciences.
And I think there's a need to really work with the healthcare system, so really the actors like nurse, patient, doctor, hand in hand to understand the needs and to innovate like new solutions.
To make this a reality, it takes a lot of different stakeholders to make this change.
The great ambition we had in this team was to support affiliates with the emerging needs from patients in the middle of the pandemic.
So the main driver was really the need to bring in telehealth solutions, you know, when people couldn't get to hospital, and to kind of keep the delivery of our medicines going.
We're actually talking about the unmet need to create new care paths for patients.
We are an example of a self-organized team working in this networked way, you know, and bringing affiliates together.
So at the moment, we're really focused on our framework so that we can create enough pipeline of innovation that is hitting the market faster.
Women Health 2030 is a collaborative platform that intends to work together with the local ecosystems.
Not to become a Roche-owned initiative, but being really owned by a collaborative approach.
Working as well hand in hand with a multi-diverse group of stakeholders at a local and regional levels to ensure that the right frameworks to maximize those solutions are in place in time.
Imagine you have Roche on the table that brings the expertise and the member of the government that can bring this policy perspective.
So we wanted really the teams to meet startups or patient organizations or other organizations that they can collaborate with outside of Roche.
Finding doctors, we're finding these private hospitals, private clinics to see what if we provide these consultation services online in virtual.
And I think we really see an impact on the people that are part of this program and continue even after the program.
We'll be able to network with different affiliates in different countries, whereby we can share learnings, we can share the success that we have, so that we can accelerate the innovation within Roche.
We're very open to any organization, any employee that has a concept and an idea.
Delivering more outcomes and having a greater impact.
The innovation ecosystem is really, flourishing and growing.
I see Roche as a company that understands fully what it means to be ready for the needs of our times.
I believe this generation of impact can be a good inspiration for a Roche transformation.